Somerville Housing, a quality improvement project. Welcome. This presentation is being presented by myself, April Brown, RN, in collaboration with Megan Orndorff, RN, and Brandy Vela, RN. We are RN to BSN nursing students at St. Mary of the Woods College. Here is an overview of what will be included in this presentation. First, the purpose of this presentation will be discussed. Next, Hope General Hospital's annual emergency room cost will be reviewed. Then, a review of evidence-based practice will be discussed, which provides the basis of the Quality Improvement Project, a discharge home service. Included in the Quality Improvement Project is the utilization of an interprofessional team called the Improvement Patient Outcomes Team, otherwise known as IPO team for short. Then the projected cost of the Quality Improvement Project will be discussed. And finally, the projected cost savings for Hope General Hospital's Emergency Department in implementing the Quality Improvement Projects will be reviewed. The purpose of this presentation is to analyze cost factors and quality of care issues for Somerville Housing Project residents. Hope General Hospital has identified 12 Somerville residents as intense utilizers of its emergency room. Each individual, 12 total, exceed over $100,000 in annual care cost. Megan, Brandy, and myself are serving with an interprofessional team and are charged with developing an innovative quality improvement project in order to reduce Hope General Hospital's ER costs and improve patient outcomes.
This slide is an overview of Hope General Hospital's annual emergency room cost. As you can see, COPD accounts for 51%, or $1.479 million each year. The next highest disease-associated cost is asthma, accounting for 33% of the emergency room cost. Diabetes is third, accounting for 11%, followed by cancer with 5% of Hope General Hospital's annual emergency room cost. Hope General Hospital spends a little over $2.9 million annually, managing 12 intense utilizers residing at Somerville Housing. In a study conducted by Arnold, Bies, and Fulas in 2015, of the 98 COPD patients participating in a pharmacist-physician intervention, only 9, which is 9.2%, were readmitted within 30 days. However, comorbidities, excluding COPD, were the main reason for readmission. Hammerlane, Mueller, and Schultz conducted a study in 2011 in which 757 patients were evaluated for proper inhalation technique by a pharmacist, 78% of which made an error in their technique. After pharmacist-led education regarding proper inhalation technique, only 28% made an error when reevaluated. According to Siri, Rao, and Alexopoulos in 2007, the most common psychiatric disorder in patients with COPD is depression. In their study, antidepressant therapies were supplemented with a personalized care manager, and patients were found to be more interactive with their own care. The patients had more self-motivation, adhered to the medical regimen, and had more energy.
This is a list of the IPO team of interprofessional healthcare workers and their annual earnings. From top to bottom, an NP will be staffed full-time for $85,000. An RN will be staffed full-time for $52,000. An LPN will be staffed full-time for $38,000. A pharmacist will be staffed at 20 hours each week for an annual salary of $38,000. A pharmacist tech will be staffed full-time for $25,000. An EMT will be staffed full-time for $20,000. An SW will be staffed full-time for $40,000. An RT will be staffed full-time for $40,000. A PT will be staffed at 20 hours each week for an annual salary of $30,000. PT students will be under the supervision of the physical therapist and will provide patient services free of charge. And finally, a program clerk will be staffed full-time for $20,000. The annual cost of the IPO team amounts to $400,000 annually. When patients are identified as an intense utilizer of Hope General Hospital's emergency department, the IPO pharmacist and nurse practitioner meet and collaborate each patient's care needs based off of medical diagnoses. The IPO pharmacist reviews and reconciles each patient's medication profile, making omission and addition suggestions to the IPO nurse practitioner. The pharmacist will provide education to patients on proper inhalation technique in order to ensure medication effectiveness and usage. The pharmacist technician will reinforce this teaching and provide medication setup. This will maximize cost efficiency by reducing waste and overall costs. The pharmacist will also provide oversight to the pharmacist technician. In addition to medication reconciliation, the nurse practitioner will establish rapport with current and newly identified intense utilizers upon arrival to the emergency room. The nurse practitioner will educate each patient of the benefits available with being followed by the IPO team. Once agreement is established, the nurse practitioner will conduct a head-to-toe assessment and evaluate the patient for needs. This information will then be given to the IPO RN. The IPO registered nurse will meet each patient while in the emergency room to develop rapport. Once the patient is discharged home, the RN will visit the patient within 24 hours and conduct an initial assessment and establish a personalized plan of care. After this meeting, the IPO LPN will be instructed on each patient's needs and provide ongoing basic patient care until discharge from the program. The IPO physical therapist and respiratory therapist will also meet each patient while in the emergency room in order to develop rapport and gather information for each patient's personalized plan of care. The physical therapist clinical students will reinforce educational teaching provided by the physical therapist. According to Siri, Raw, and Alexopoulos in 2007, a care manager, such as a social worker, reviews 6 barrier areas with each patient to identify potential depression-related obstacles to their care. These barriers include COPD misconceptions, obstacles to treatment, denial of needed care, COPD-related guilt, cognitive misrepresentations, and poor mobility and function. The IPO social worker will conduct a brief questionnaire at bedside to identify any of these potential barriers as well as physiological needs. The IPO social worker will then report all findings to the nurse practitioner. The IPO EMT will meet each patient within 24 hours of discharge home in order to develop rapport and reinforce teaching provided by other disciplines. If a discharged IPO patient calls with an emergency, the IPO EMT will be the first responder. The IPO program clerk is responsible for the administrative and billing duties for the IPO team. Supply orders, phone calls, and keeping logs of IPO patients' physician appointments will be the main duties of this role. The IPO program clerk is responsible for making post-discharge phone calls, as was previously discussed. Office hours will be from 8 a.m. to 5 p.m., at which time all phone calls will be forwarded to Hope General Hospital's answering service, with calls being forwarded to whomever is on call, the nurse practitioner, the registered nurse, or the EMT. The annual IPO team expenses include $400,000 in fixed costs comprising of the IPO team's salaries. This accounts for 91% of projected costs. Variable costs include patient and office supplies and comprise $40,000 annually, or 9% of projected costs. As for renting a Somerville housing unit, federally funded grants have been awarded to pay each month's rent for a period of 2 years. At that time, the IPO team will apply for another federal grant. With regards to the unit being utilized as the IPO team office, the Somerville Housing Authority has agreed to provide all utilities free of charge to the IPO team. The total amount of money paid on behalf of the IPO team will then be used as a tax benefit to the Somerville Housing Authority.
Projected cost savings to Hope General Hospital's emergency department is anticipated to be $2,489,000 annually, provided that the IPO team is successful in reducing readmission rates by 100%. This is an 84% reduction in Hope General Hospital's emergency department expenses. This slide contains the references utilized by April, Brandy, and myself. Thank you for your time in viewing our presentation.